Hello and welcome. I'm Rachel Levy, a healthcare reporter at Politico. I'm pleased to welcome Senator Michael Bennet, Democrat of Colorado, to the Harvard Chan studio. This conversation is part of a series called Public Health on the Brink, which explores the most urgent challenges facing public health, as well as promising solutions. Let's dive right in. So, as you know, we're awaiting a Supreme Court decision that could overturn the right to abortion set forth in Roe v. Wade. Senator, you and many of your Democratic colleagues support abortion rights, but you have not had the votes to pass a federal bill protecting abortion rights. How do you view the outlook for women's reproductive freedom in this country?
Well, I think the view in the moment is very dim because of the draft opinion that was leaked from the Supreme Court. I think it's very important for us to elect a pro-choice majority in the House and in the Senate. And I think, the American people are going to be shocked when they discover that this right that they've counted on for the last 50 years has been eviscerated by a 30-year campaign to change the law that's apparently resulting in this Supreme Court opinion. I will say the state of Colorado has already passed a bill to protect a woman's right to choose, and I think states all across the country are going to do that as well.
And do you think the conservative majority on the court is prepared to overturn other rights that may now be taken for granted, such as the right to same-sex marriage?
I think that's very possible. I mean, it is. As a lawyer, I deeply regret the fact that the draft opinion was leaked. I think that's terrible. It's a terrible abandonment of the responsibilities of people that are working at the court, and the court may revise it, they may change their mind, but it's very clear that Alito is very cavalier about undoing this right that was enshrined by Roe versus Wade, and I have no reason to think that they wouldn't treat gay marriage the same way.
Do you think that individual states will take on the same mantle that you're describing for abortion rights as well?
I do. It runs the risk of, having a divided country. Some of the states, supporting abortion rights and gay marriage, some of the states taking an opposite view. And I think that's why, in the end, I think we're going to have to elect majorities in the Congress to deal with this on a national level.
Mm-hmm. Okay, well, let's talk now about antibiotics, switch tacks a little bit. As you know, deadly pathogens are evolving resistance to our most widely used antibiotics. It's a huge public health threat that kills more people worldwide than malaria or HIV. The UK recently took a major step toward implementing a new model designed to spur development of new antibiotics by effectively paying for them in advance. You've been trying for years to get a similar bill passed in this country, and you have some bipartisan support, but it hasn't advanced. How would you move the bill forward, and what are the obstacles here?
Well, the obstacles are just Washington dysfunction, and that is something that we have to fix broadly if we're going to compete with, countries around the world, in particular the totalitarian society in China. We've really got to do a better job. We got to get our act together on the antimicrobial resistance. I think I've got a Republican colleague, Todd Young, who's my co-sponsor of the bill. The bill makes a tremendous amount of sense because the market for these antimicrobial drugs is broken in the United States. We have to have, as you said, a system where we're paying in advance, where in effect what we have is a subscription system like Netflix, so that there will be a market to produce these drugs that are going to be incredibly important for what, by some estimates, will be the biggest killer of humanity. And I think that in the wake of COVID, there's going to be momentum to pass this bill. We just have to find the right. We just have to find the right place to, the right vehicle for it.
Yeah. You mentioned some of the obstacles here, but, is there anything else that can be done at this point?
In terms of the legislation, or
Mm-hmm.
I think we just have to keep pushing and make sure people understand that the complete lack of preparation that we saw for COVID is not something we want to repeat. And with respect to antimicrobial resistant diseases. And that's why we've got to pass this in advance so that we're developing the drugs we're going to need before the calamity actually arises. And I'm just going to have to make this case in a compelling way, and I think we'll get it done.
Mm-hmm. I have a related question, something that's much more present right now with the pandemic. Some of my reporting has showed how much the pandemic has really made it difficult for hospitals struggling with infection control specifically. During some of the COVID surges, especially this past winter, thousands of patients each week were contracting the virus while in the hospital for unrelated medical issues. Some of the public health experts I've talked to think it's related to sort of lax safety measures taking place at hospitals, and lax infection control, regardless of COVID, as you know, can also lead to the spread of new antibiotic-resistant strains of disease. What do you think about the federal government's levers here? Do you have the levers to impose tougher standards?
First of all, what you're describing is a huge problem. It's a huge issue. And I think that my sense of it is that it's a bigger problem in the United States than it is in some other countries around the world. People go in for one treatment to a hospital and they end up with another infection that kills them. There are millions of dollars in the antimicrobial bill to go to hospitals to do, to put in protocols to avoid the kind of infections that you're talking about. I think more broadly, we have to make some pretty serious investments in our rural hospitals in this country. It's been a generation or 2 generations really since we built the rural hospitals in America, and they're wearing out, they're falling apart, and I think we've got to invest in them. And it's another piece of legislation that I have. I'd say on top of that, we have a really profound challenge attracting talent to our rural hospitals, and I think that's a reason we actually have to fix our immigration system so that we can have the people that we need to be nurses and doctors and in our hard to serve areas, and that can also help us curb infection, I think.
Mm-hmm. But right now we're in this pandemic, and I understand some of these things that you're describing. It seems like that could take, a lot of time potentially to get in place. I mean, do you think there's anything the federal government has in its toolbox now to maybe impose tougher standards for infection control, especially around COVID inside hospitals today?
I haven't looked at it, but I think it's something we ought to think about.
Okay. One related question to this is, I know that the federal government, specifically HHS, has data on COVID infections at hospitals. This has been data that they've been tracking throughout the pandemic, or for much of the pandemic. The data isn't public. In your view, do you think HHS should release data by individual hospitals so that patients can understand how their local hospital does on these measures?
I actually haven't looked at that with respect to COVID, and that's something that I'd like to examine. As a general matter, I think it's better to have more data than less, and more of it public than less.
Mm-hmm. By the same token, this is another COVID related question. Do you think the federal government should require better respiratory protection in healthcare to prevent COVID transmission to patients and staff?
I haven't looked at that either, so I'll take a look at it.
Okay, sure. And I know that you recently had a bout of COVID, I think a few weeks ago, and so many Americans have gotten this now, and there are these emerging concerns around potential long-term consequences of these infections, including long COVID primarily. What do you think the government's role is here? I don't know if there's anything you've been working on in particular.
I think we have a really important role to play. First of all, we can't forget the people that have long COVID, and these are people that are no longer testing positive, but often have really severe or chronic respiratory illnesses. I think the most important role for the federal government would be to fund research to make sure we're studying the long-term effects of COVID, and especially, by the way, in children, where we're seeing, hepatitis-like symptoms in kids with long COVID. We don't know much about it, and it's something we have to study, because we really, as we sit here today, in many ways, this is really a new disease for us to contemplate. So I think study is really important, and the money to pay for it.
So with the midterms looming and the government warning of a fall spike in COVID, do you fear a return to deep politicization of the pandemic?
I am worried about the politicization of the pandemic. I've been worried about that the whole way along. And I think it's critically important for us to, now that we have vaccines, now that we have, reopened in effect, I think it's very important for us to try to stay open, to make sure that kids stay in school. We know how difficult this period of interrupted schooling has been for children. It's really been staggeringly difficult for them, for their mental health. So my hope is that on both sides, we depoliticize this. We do everything we can do to try to keep the country open. That's what we really have to do.
Do you just have a quick follow-up on that? I mean, our vaccination rate in this country is lagging compared to, similarly wealthy and industrialized countries. And I'm wondering if you think there's anything more that the government can do there to try to get more Americans vaccinated.
I really am not sure there is more the government can do. I think that local public health folks and local community leaders can continue to make people aware of the great benefit there is to being vaccinated. And I think that is probably the most useful thing that we can do at this point.
Switching gears here a little bit, the pandemic has really underscored that we also have an enormous mental health crisis in this country. New data from the CDC shows that more than 40% of teens feel persistently sad or hopeless, and about 1 in 5 have contemplated suicide. You've talked in the past about the need to reform our system of mental health care. What are the top actions that you think the federal government could take to address this crisis?
I think that, first of all, we are having, as you point out in your question, a massive mental health crisis in America. I see it everywhere I go in Colorado, and it's especially in young people who have been dealing with interrupted schooling as part of it. I'm also wondering whether or not this economy has any place for them at all. I mean, there are deep concerns. And I also think that there's a big effect on social media when you've got a majority of teenagers saying that, they're addicted to social media. So that there's a lot there for us to deal with. I think as a broad measure, what we've got to do is figure out how to identify mental health issues earlier on in their onset. There's some estimates that I've seen that says on average, mental health issues are diagnosed 10 years after they first present themselves. And that's why John Cornyn, as a Republican from Texas, and I have issued a white paper saying we've got to reorient the incentives in our healthcare system so that there's earlier diagnosis of mental health issues. I'm working on the finance committee as well with Democrats and Republicans to see what we can do to change the Medicare and Medicaid system to better support this Americans through this mental health crisis that they're struggling with. This is a tough time for us, and we've got basically our entire system of healthcare, contemplates issues related to physical health, but has never treated mental health as an equal issue, and it is clearly just as important as physical health.
Yeah. What do you think the political obstacles are here?
I think the political obstacles historically have been, shame and not an unwillingness to talk about mental health issues. But I think we're overcoming that, and the next generation of Americans, I think, is better at talking about their mental health issues than previous generations, and I believe they feel less stigma too, and that ought to remove some of the political obstacles that we've had in the past.
Mm-hmm. I wanted to move a little bit over now to prescription drug prices. Members of Congress from both parties have been talking for a while now about the need to bring down the cost of prescription drugs. There hasn't been much progress on that front, and wanted to know if you could talk about what you're doing to address this issue.
I think the most important thing we could do is have Medicare negotiate drug prices on behalf of seniors and basically and the entire country. It's ridiculous that we don't have that power. And I want to tell you, I've been with Coloradans recently who are seniors who basically are literally spending their entire retirement negotiating over drug prices with pharmacies, with insurance companies. They're making decisions about what drugs not to take and what drugs to take. They're cutting their prescriptions in half or not taking them at all. It's a tragedy. I mean, the idea that you consume 30 years of your life after you're retired, after you've worked your entire life, in that kind of negotiation that no one else in the industrialized world has to have it is shameful. So I think that at a minimum, Medicare ought to be able to negotiate prices. I think we should cap the price of insulin and as you know, with respect, just like we were talking about earlier with COVID, I think creating much more transparency in our healthcare system so people can actually understand what stuff actually costs, whether it's drugs or whether it's medical procedures of any kind. People have absolutely no idea what anything really costs in our healthcare system. And, you know, for a long time, opacity has been a business model for healthcare in America. That has to change.
Is that potentially an argument to have sort of a single payer system, maybe to a national healthcare system similar to what's in the UK, for example?
Well, we're spending more than twice what any other industrialized country is spending on healthcare and getting worse results. So, you know, I think our system does have to change. I've suggested that the way to change it would be to have a public option. Mine is called Medicare X. I wrote it with Tim Kaine that would give every American the chance, if they choose, to pick the public option administered by Medicare instead of private insurance. I think that would create competition for private insurance and help reduce costs.
You've spent a lot of time working on a wide range of public health issues. In just 30 seconds, could you cap what, in your view, is the single biggest obstacle to improving health and healthcare in this country?
I'd say the corruption of our political system with money that prevents Congress from making decisions to give Americans the kind of access, for example, to lower cost prescription drugs that people in other industrialized world have. And I think the lack of universal health care for the same reason through a public option is preventing families from getting the kind of primary care that would keep Americans healthier before they end up in the hospitals. And I think that's something we can overcome. It's something that we can fix. It's something we have to fix.
Senator, thank you so much for your time and for
Thank you so much for having me. I appreciate it.